Welcome everyone to Nash therapeutics study streak. We have so far covered a lot of remedies which are related to each other and the way Nash has described, not alphabetical, not some random arrangement, but complementary action, which is what a homeopath should be doing when he practices or analyzes or uh, does a comparative study or differentiation study. And today we'll discuss two interesting remedies. The first remedy is ipecac and the second is antimptot. No homeopathic practice, whether gastric or respiratory, is incomplete or complete, rather, I would say. No homeopathic practice is complete without the presence of these two remedies, ipecac and antimptot. Most importantly, Dr. Nash describes us how to use these remedies and what will be the clinical key features of the patient in your clinics. No random theories, no high uh, language rubrics, nothing out of the way, something that you all know, but how to employ it in practice is what Dr. Nash elaborates in his Leaders of Homeopathic Therapeutics for these two remedies. Good to see a few people, Dr. Priya Soni, Dynamic Issue, SR Homeocare, Mukesh 3716. I don't know how many of you are online, but if you are sticking till the end, then something of practical use is going to be revealed from Dr. Nash if you have not read it. And if you have read it, then it might as well be a revision for you, which is also very important. So let's proceed without much fanfare. Ipecac, the very first line Dr. Nash tells in his book Leaders in Homeopathic Therapeutics, is that this remedy leads all the remedies for nausea. And we all know that there is persistent nausea in all the patients who have been given ipecac or will require ipecac. And then in couple of paragraphs, Dr. Nash explains what is persistent nausea of ipecac. Fairly understood. Next, what he does is something which is required for a homeopath to understand from comparative and differentiation point of view, and that is that he compares ipecac with pulsatilla. Many patients that we see, we will feel that this seems to be pulsatilla for sure. This seems to be ipecac for sure. But how will we differentiate both these remedies? If you are watching on YouTube, there is a beautiful diagrammatic picture that I put up. Homeo Setu is the name of the YouTube channel. I'm showing there the session with the PowerPoint. On Instagram, it's just a random talk which goes on because we don't have a screen share option. If Instagram comes out with this feature, then it's gonna make people go berserk, especially all the homeopaths who are posting content throughout the day. So, anyways, Dr. Nash compares ipecac with pulsatilla, and he tells us that if the vomiting has happened and the food is still there in the stomach, or the vomiting is partly done but the patient does not have the desire to vomit, but the food is still there in the stomach, the quantity didn't come out as much as the patient had eaten, or he feels that the stomach is still bloated, that is pulsatilla for you. And if the food comes out and still the nausea is persistent, that is ipecac for you. Apart from seeing that the tongue is coated or not coated, which you will always find from ipecac patients that it is clean, not coated tongue, whereas pulsatilla and antimicrobe, Dr. Nash tells, are very close in prescribing to such patients who have coated tongue. So he gives a short explanation of all these three remedies, and then he proceeds in telling that nausea and clean tongue is seen in many conditions. And ipecac will be seen in nausea and clean tongue, whereas Sina will be employed or we need to give Sina in all cases where there is clean tongue and worm conditions or persistent nausea accompanying. Now, this is slightly difficult to understand because no, worm conditions are in itself a challenge for homeopath. So, if you are following this page Homeosetu on Instagram, Facebook, or YouTube, you will be learning about uh, how will you prescribe in worm conditions certain different remedies, and I'll be putting up some cases from my own practice. But for now, let's keep it theoretical because to deal with it is different and practically important to understand when to give which remedy, how to give which remedy, how to stop allopathic medications which the patients are on every 6 months albendazole. Going further, Dr. Nash describes the clean tongue and nausea and heart condition. Think of digitalis as the remedy. So we have something that is very much interrelated with all the tongue clean and nausea, worm conditions, and heart conditions for Ipecac, Sina, and digitalis respectively. And next he goes to describe that not only the upper gastric tract is involved for ipecac, but the middle portion or the small intestine and the large intestines, the bowels per se are also involved. And he explains how beautifully he explains is worth noticing. Patients will not be able to detect the origin of the complaints. Patients will not be able to understand where the complaint begins, but it is the physician's job to do that, and rightly said so by all the practitioners who are seeing patients day in and day out. A patient will present to you with complaints of mucus stools. A patient may present to you with complaints of foamy or frothy stools, and it's a summer season. How will you understand what remedy to give? So, Dr. Nash describes the looseness of bowels in this paragraph, and he tells us that looseness of bowels is there in ipecac or in ipecac patients who require ipecac. In patients who require ipecac, the looseness of bowels is seen in three types. Number one is in the type of fermented stools. It can be foamy, frothy, like yeast. Number two will be like grass green stools, or which is mucus and watery, what we understand from the patient's under presentation. And number three, what Dr. Nash tells is a slimy stool or dysenteric and bloody stool. And these three will be the major presentations where you will require to give ipecac in all the cases of disturbed bowel conditions with the nausea present. So, if you want to save the child from further complications in the cases where the complaints have just begin with a frothy or foamy stool, mucus stool, watery stool, dysenteric or bloody stool, right away we can start the patient on ipecac. And the magic you will see in your clinics or wherever the patient is will save the patient from danger of falling into some complicated illness. So, Dr. Nash describes this looseness of bowels in three parts. Then he goes further and describes the nausea before the headache. He describes that ipecac is no doubt a remedy for all the types of nausea, all the types of fermented stools, looseness of bowels, etc., etc. But ipecac can also be thought in all the cases of headaches, especially where the nausea is the first symptom and then the headache has happened. We have so many cases of migraines and headache which come to us. We can just ask these questions and make our landmarks. Did the nausea start before or after? If it is before, it is ipecac. If it is after, there are other remedies. And we'll streamline the entire content slowly as we progress from Dr. Nash's leaders in homeopathic therapeutics. So, about nausea, Dr. Nash quotes Herring like he has been doing in all the past few remedies, all the remedies, and he tells us that in Ipecac, Dr. Herring tells in Ipecac there is nausea, distressing constant with almost all complaints as if from stomach with empty eructations, accumulation of saliva, qualmishness, and efforts to vomit. Nothing relieves. So this entire description sums up what exactly is the presentation of Ipecac in your clinics. And if you just understand these three lines, it is going to simplify your prescription and you need not go into complicated rubrics, you need not go into complicated methods or content. It is just as simple as that what Dr. Nash lays down the words from Herring as it is, that there is constant distressing nausea and with all complaints and it does not relieve. And then Dr. Nash goes on further to describe that Ipecac affects the lining of the respiratory organs and that of alimentary tract. So it is, something that is so much specific. It is not told that it acts on the respiratory organs, but on the lining of the respiratory organs, on the lining of the alimentary tract. And there is accumulation of mucus which loads the bronchi, which is mentioned by Dr. Nash, until there is danger of suffocation. So you have to understand these words, that until there is danger of suffocation. So the patient is not suffocated like we see in entimtat, like we see in opium, but there is danger of suffocation. So what happens if there is danger of suffocation? There will be spasm. And this is the phase of first stage of all coughs and first stage of asthma. Next, Dr. Nash mentions that all the cases of first stages of asthma and cough before the stage of mucus, or if there is little mucus present, Ipecac is the remedy that you can think. So it goes in line with what he has told earlier, that there is accumulation of mucus and there is danger of suffocation. So there is no suffocation per se, but there is danger of suffocation. If you understand these words, you have to understand, we say read between the lines and hear between the words. So it's like that. Every word, like we say in Kent or Boric or Ellen, is important. Every book that we read has these hidden meanings which we need to pick up. Danger of suffocation for Ipecac would mean that the patient would land up into the suffocation stage anytime, and if we try to recognize this phase, Ipecac is the remedy we can think of. If the patient lands to us after a day or two where the suffocation has happened, or there is lot of accumulation of mucus and consolidation of mucus in the chest, antimtart is the next remedy that we can think of. So Dr. Nash tells us that first stage of asthma and first stage of cough, Ipecac. I bet none of the homeopaths or very few homeopaths would be giving Ipecac as the first remedy for cough. We always want nausea to be present. We always want gastric symptoms to be present. That is how we are, fed with. And this is the prejudiced thinking that we develop. If it is the initial part of the cough where there is danger of suffocation or the patient may land into suffocation anytime that we see the patient, then that is the ground for prescribing Ipecac. And on examination, the tongue will be clean, but there will be lot of saliva. So you will think that, "Arey, Merksol dikh raha hai." We think that it is looking like a Merksol patient, but Merksol has a different sphere of action, and Ipecac has a different sphere of action. So salivating tongue, which is clean, no nausea, but the cough has just begun. That is the recipe for Ipecac. You will be solving a lot of cases based upon only these things that are present. So Dr. Nash tells us that it is to be employed, this remedy is to be employed in all the cases where there is suffocating cough or where the child becomes stiff and blue in the face. And he may also recover fast. But if he remains stiff and blue for a long time, then that is antimptot or opium stage, which is the next remedy, antimptot, that we'll cover with a small differentiation of opium mentioned by Dr. Nash. Going further, what Dr. Nash describes is that the respiratory troubles of Ipecac can be divided into two categories. Number one is excessive accumulation of mucus, and number two, those cases where spasm is a characteristic feature. So what we read so far goes in line with what he mentions now, that respiratory troubles have two stages. One is accumulation of mucus, where the mucus is collecting. It has still not collected. It has still, and how will you understand it has still not collected, or it is still collecting? By your clinical examination. If you have a good experience of examining patients, then you will be able to understand whether the mucus is accumulating in the chest or it has already accumulated. Something like coarse crepes, something like a dull percussion zone. These will be the indications for you to understand that the cough has already settled and kind of blocked the bronchiole. This is where you will require maybe a deeper remedy, antimptot, phosphorus, sepia. But if it is still showing some, open areas in that zone of the lung, then that is Ipecac for you to prescribe. Maybe Bryonia also. So spasm of the part or the patient, and accumulation of mucus, and or accumulation. It is or which Dr. Nash mentions. These are the two conditions. And next he describes the hemorrhages of Ipecac, which are bright red. They are not decomposed compared to Crotalus, sulfuric acid, and Cicalcor, which have different presentations of hemorrhages. And then he gives a long one-page list of all the hemorrhagic remedies. I have not brought all the hemorrhagic remedies on paper. It's the job of all the viewers, those who are live right now, to see these remedies and find out from uh, leaders in homeopathic therapeutics about these remedies that you need to understand have been mentioned by him for hemorrhage and the nature of the hemorrhages. Okay, so next and last, Dr. Nash comes up to Ipecac as a remedy to prescribe in fevers. And where do you find these remedies in fevers? If you have given it in fevers, you are very lucky enough to see good cures. If you have not given in fevers, then I guess you are missing out on a very incredibly good remedy in fevers. Fevers are not about aconite, belladonna, and crocin, which all the homeopaths give, but a systematic way of understanding. And I have taken a fever workshop. It will be put up soon for you all to watch and find out about how you can treat fevers. But what Dr. Nash says, and he quotes Dr. Jhar because Jhar was the authority for a lot of such cases that he saw. Dr. Jhar recommends Ipecac in all the cases of beginning of fevers, unless there are specific indications for some other remedy. Now, next he goes and describes that how Ipecac is different from other remedies: arsenic album, eupatorium, ignatia, capsicum, natramur, rustox, podo, entimtat. You need to open leaders in homeopathic therapeutics. You open the physical copy and you will read the remedies, because all the apps will give you a distorted view. There are different apps, there are different content of the book which is mentioned. The original book is completely lost by all the applications. I would not recommend. Go for the physical copy, read the physical copy. You will understand how Dr. Nash has described Ipecac as a remedy to be prescribed in fevers. Next remedy that we'll be discussing is entimtat, and Dr. Nash mentions this remedy after Ipecac because this is the remedy which is almost indicated after Ipecac if the case has progressed into suffocation or accumulation of cough, coarse crepes, or dullness in the chest region when we examine. He mentions and he starts entimtat by telling us that another powerful emetic, but there is not a persistent nausea like Ipecac, and there is also relief from vomiting as compared to Ipecac, where there is no relief from vomiting. So these are the two major indications in all the patients that you are going to experience or see. Next, Dr. Nash tells us that entimtat has been used by him for 25 years in all the cases of cholera. He calls it as near specific remedy. And there is not a textbook at that time which recommended entimtat as a remedy for cholera, but Dr. Nash gave it and found it useful. So this is the clinical experience that we should look for. Such authors who have brought the data together from their own practice, and not because some textbook is telling us, and something that is verified, something that he has cured for 25 years. What does 25 years mean? If you are in the 5, 7, 10 years of your practice, you will understand what 25 years means. So entimtat was given by Dr. Nash as near specific in all the cholera cases, and then he explains how entimtat is useful in all the respiratory cases. There would be coarse rattling. Now I cannot explain this coarse rattling in words or theory right now, but maybe at another time if there is a chance to take up a workshop to help you understand how does coarse rattling mean. In fact, there is a video which I had posted long back about clinical experiences. I had explained how a pneumonia case was developing and how the remedy given based upon the rubrics I took helped. You can go into the feed clinical experiences, especially those who are on Instagram. In the feed, there is mentioned about this remedy and the rubric which I took for this particular case, and how coarse rattling was one of the key features of the case and how it helped. So I don't see any homeopath right now, or very few homeopaths who explain these things uh, on a on a on a platform like this, social media, because everyone is coming and banging every other homeopath with rubrics and remedies and rare remedies and materia medica and etc. But you need to also explain the student or the other people about how you have examined the cases. If you don't do that, then we are just theoretically thinking about concepts. We are not dealing with real patients, which is what our work is. So all those who want to go through this particular video, go in the feed of Instagram and find out clinical experiences and one of the cases I've shared. What is the concomitant that we will see in antimptot? We all know drowsiness and sleepiness. But on the same drowsiness and sleepiness parameter, we also have opium as a remedy which we feel is indicated. So, how we will be able to differentiate these two remedies? Very simple. In 3 lines, Dr. Nash explains the differentiation of these two remedies. That's the only thing you need to remember. No rubrics, no specific methods, no out of the world narratives. Antimtat will have a pale face, cyanotic appearance. Opium will have dark red face, purple in color, and there will be sign or stertorous respiration. That's the biggest differentiation I ever find for antimtat and opium. Next, you see is clinical findings for antimtat. What will be the clinical findings for antimtat that you will see when you examine such a patient? And Dr. Nash gave the description in 1900s, 1890s, and we are running after new methods, new rubrics, rare remedies, rare methods, and whiplashing our own minds with something that we shouldn't be doing because everything is there in the source books. And I would consider Nash as one of the source book, because if a author has given you the mention of clinical findings of a remedy, how valuable is that? In cases of pneumonia or in cases where the chest trouble is developing, what is the clinical finding that you will see? There will be dullness on percussion is number one thing. There will be absence of respiratory murmur. There will be shortness of breath. The patient is pale, weak, and sleepy. What else do you need to decide on a remedy? You don't need any out of the world narrative or new method, but this remedy is going to work wonders if you focus on these 4 5 things. Last but not the least, Dr. Nash explains that in many cases we are giving sulfur as a remedy to absorb something from the localized part or the part which is swollen. And if you're not using sulfur as a remedy to absorb, you're missing out on something that is valuable. So in certain books, in fact in Boger synoptic key, you will see that there is a rubric absorption, absorbent action. You will see arnica and kali iode mentioned. In bigger repertories, you will also find sulfur as a remedy. In fact, sulfur should have been there in Boger, but I think it's there in the supplementary table. So sulfur is a remedy which, where there is lot of swelling, you have given some remedy which is indicated, and the absorption has not happened but the pain is gone. Sulfur is given to such cases. In chest complaints, if you have given sulfur, there is absorption of the fluid accumulated or the disease product, but it has not helped so much. Antimtat is going to finish off the work. We saw that in 1 or 2 lines, Dr. Nash has explained similar relationships of remedies like coffea and chamomilla, like merksol and arsenic, we have taken up in the past. Just 1 or 2 lines of differentiation recently, just a few minutes ago, we did about for the same differentiation for antimtat and opium. So that is the beauty of Leaders in Homeopathic Therapeutics by Dr. Nash. 2 or 3 lines of explanation, that is what you will be clinically seeing. Dr. Nash has used antimtat. This is the final statement from him, from 200 to the cm potency, and with really good results. So you can employ it and also find it useful. uh, I hope those who are watching the live, they have got a good experience of what is all about leaders in homeopathic therapeutics, Dr. Mukesh, Yogesh, and Dr. Kushi. You are there till the end. I hope this remedy helps, this video helps. Let me know in the comments. And for 2025, follow Homeosetu Instagram, YouTube, Facebook, Threads, Twitter, everywhere. There is going to be an interesting learning that everyone is going to experience from Homeosetu.